Welcome to Behind the Scraps Couch, where real stories, expert voices, trusted health conversations come together. Before we begin, please remember that this interview is for educational purposes only and does not replace professional medical advice. If you enjoy credible health content, don't forget to like, share, subscribe, and turn on your notification to African Health Excellence. Now grab a seat. The conversation starts now. All right. So you were still telling me, Thabang, that from a distance, whenever people look at you, they think you have money. Can you tell me more
Yeah,
about that?
yeah, definitely. People think I've got money, and I've been looking at my circle and people beyond my circle. Whenever they see me, can you please help me with money for this? Help me with money for this.
Mm.
Help me with money for CVs. Help me with money for food. And I'm like, maybe they do see something that I haven't seen in myself. Maybe I'm still yet to be a
Mm.
millionaire. Hence, everybody see a millionaire. That's I'm just assuming.
Maybe they visited the future, so back
Yeah,
the future price.
yeah, probably. One thing
Mm,
one thing
mm,
that made me to laugh was I was with my the youngest of my children is a boy, and we were
mm.
traveling through the town where we stay, and he said to me, "Daddy, please buy me this." And I said, "You know what? I don't have money as yet." But he said to me, "But you've got the card, so you can easily swipe." So I know I
Oh,
didn't have money in the card, but my
mm,
child saw
mm.
money in my card that I can easily swipe. So hence I'm saying everybody sees money in me, but I haven't touched it in real life.
Maybe yeah, it means it's coming and it's coming very soon. It's close by.
No, surely I would receive that with warm hands.
Okay, and tell us about young Tabang. What kind of a child were you growing up?
I was born and bred in deep rural villages of Limpopo, called Matox in Motokwa. So growing
Mm.
up there under a family that is so lovely, that is so welcoming, and I got to learn so much that I was raised in a very well-mannered family. They love people, so hence I am here today. Pouring back what I was taught at home to other people. So I grew up as a very respectful child. I grew up very inquisitive. I also always wanted to go beyond what people would say. So I schooled in Limpopo from my primary level to the high school level. Then from then I moved over to Gauteng, but my childhood was a very good upbringing. I've got a very good upbringing, and I've always been a friendly person from my childhood to this point, and I'm very accommodative. That's the kind of a child I grew up as, but very naughty, very naughty. I was, and I think the naughty part is the one that brought me to where I am today.
Mm, okay. And what values did your parents instill in you that continue to shape your life?
Number one, every elderly person that I come across in the streets, that particular
Mm,
person is my parent. So
mm,
the parentship doesn't only get to be limited by my household, but beyond that, every person that I get to meet on the street, I have to respect them. As much as I respect my parents, what I could do for my parents, I must also do to the people outside my family borders. So
mm,
I definitely think that how I was brought up was in a manner that see everybody with respect. Don't let situations of other people allow you to undermine them. Whether they are young, they are old, but the values from my family is that respect everybody, irrespective of where they come from, irrespective of their conditions. But they are also your parents, even in the streets.
No, that's true. And that really helps a lot in terms of maybe relating with other people and even helping other people. I believe those are values that we really need to instill even in our children going forward. And who in your family has had the biggest influence on the man you've become?
I would say my mother.
Mm,
I had both parents. I had my father's a family orientated man, but my mother actually. So we are three boys actually. But unfortunately, my youngest brother passed on. May his soul rest in peace. So in
mm,
all these three boys, my mother taught us very well to say that you need to become the person you want to be. You need to advocate for the person you want to be, and nobody will come from anywhere to come and shape your future. You must shape it yourself. And what I loved about my mom is that she has never put the whole porridge on the table, but she has put half so that you can make sure that you push for the other half. So I
mm,
believe that her teachings brought us in a very well manner, has made us to be the men we are today. So thank you to
mm.
her, Patricia Ramoneta.
Yeah, yeah, no, that's great. I guess, mothers, they really play a very, very big role in terms of assisting us make decisions and become the people that we want to be. Because most of the people, whenever we have an interview with them, they always indicate that, their mothers really played a big role. Obviously, even fathers do play a big role, but I believe that maybe I mean, both parents, I believe that they play different roles because obviously a father will be providing and all that, but I guess maybe because as mothers we spend most of the time taking care of the child. That is why we are able to contribute so much. And I guess it's also maybe an encouragement to mothers out there that your voice matters as a
Yeah.
mother. And it can either build or break the child, and it can either contribute positively or negatively in the future of the child. So I guess this should be a wake up call to all of us as mothers, to be very careful about the things that we say to our kids, because I feel like with most people the mother's voice is the one that's the loudest.
Yeah. Sylvia, what I can tell you is that there's a Bible verse that says a wise woman can build her own home with his hands, but a foolish one can definitely break it. And in my
Mm,
heart, I'm sitting here to say to many people, I'm not saying they should be like my mother, but I believe that
mm,
all women were born and bred to be wise, to build
mm,
families, to build futures. So I surely believe that when they say mbokotos, they really meant it to say that these are the people. In my own language, we normally say bomme ba tshwara thipa ka bogaleng. So which means the whole load is carried by them, and whatever they are carrying should be to shape the future of the generations that they are looking up to.
mm, mm. Yeah, no, that's true. And sometimes as women, we feel like, but God, such a big responsibility. Why did he say a woman? Why did he not say a wise woman and man? Why did he put so much responsibility in us? Is that fair?
You know why?
Mm,
Go to Genesis when the Bible
mm,
speaks about Adam and Eve. After
mm,
everything, when the Lord came to ask Adam what had happened, then Adam said, "The wife you gave me." So the
mm,
responsibility God gave it to a woman. So I am here to tell you that I believe that if families were being carried by men, most of those
mm,
families would have been disgruntled, would have been somehow wouldn't even be existing. But God saw
mm,
a capacity of a woman. God saw the determination of a woman. God saw the passion of a woman. And I surely believe that He saw it fit for a woman to carry the whole load, because quite men would have gave up, quite men would have lost it in the way. But women
mm.
certainly I adore what God has planted in you, because even through dark days, even through the waters, but you still carry your family, that we don't drown. So I would like to send out and shout out thank you to all the women who are playing their role in these communities we are living in. And
Mm.
I can tell you that for South Africa to be what it is, or beyond South Africa, it is women who stood up and advocating for the future, to shape the future of the world that we are living in now.
Mm, mm. No, that's great. And yeah, we should really thank God for creating women. And we believe that He's going to help women to be strong and give them the strength that they need in order to grow their families and take their families forward. So, Thabang, beyond your profession, who is Thabang when he's with family and friends?
Thabang is a very family orientated man, not only within my family, but even to extended families and other families that are not even related to me. So I surely believe that a person who's family orientated, it will be his desire to also see other families being together, being in one accord. So what my passion is to go out there and speak to men and women, to say that bringing the upbringing of our kids depend both on us. And if we can all be family orientated, I know we do have our differences as spouses, we do have differences as individuals, but in the end, I surely believe that we need each other to build a strong family. We need each other to bring up our kids in a manner that tomorrow they will look back and say, if had it not been for my father, I wouldn't be what I am. Had it not been my mother, I wouldn't be what I am. So we need both mothers and fathers to come together. That's what I'm advocating for. And Thabang is that kind of a guy who goes deep in the rural areas where very professional people are not going into. I go into the dusty
Mm,
areas. I wish I had a chance to share the pictures of places I go into. It's very unfortunate. There's a place that I'm busy taking care of. It's you know, I've always had people talking about the poor state of the nation, the poor state of this, but I've been to the West, eh? There's a certain
mm,
place I'm looking after. It's in the Krugersdorp side. So the houses
mm,
of those people are still built in mud. And when it's
mm,
raining, you know, have you ever seen mud dissolving? So this is the kind of state of people that I'm looking after. And I'm saying to them, even in this situation, there is hope. There is a light at the end of every tunnel. So I'm advocating for the poor and for the disadvantaged to still see the light, that it doesn't end
mm,
where they are. Doors can still open for them. A future can still shine bright for them, even in the situation where they are. It just needs people like Thabang to stand up and say, guys, it doesn't mean that where I am and where you are, then we become two different people. We are still the same people, but it needs people like me to go down in those deep villages where nobody is going, to say, guys, we are still here. Our hand can still extend. We can hold hands and make our communities bright again. Let not our kids let not their mind be filled with I'm from a poor family, I cannot achieve anything. I'm from a disadvantaged family, I cannot. You can still achieve if there's somebody who's still willing to give you a shoulder to cry on, who's still willing to give you an ear to listen to you. You know, I can certainly say to you, Sylvia, that in the deep rural where nobody is going, there are bright kids there, but they just need somebody to
mm.
uplift them and show them the way.
Yeah.
So this is who Thabang is in the current moment.
Mm, mm. No, that's amazing. So, what inspired you to become a nurse? Because you could have just become a public speaker, because I see you are so good.
My grandmother from the paternal side, she was a
Mm,
matron, and every time I would get sick, she would come with injections. So, oh man, I'm like, what? So she used to inject me, and in the early ages, around 12, she would allow me to vaccinate her chickens. She would allow me to vaccinate, and that felt good. And actually, I wanted to do medicine, but you know what, Sylvia? When you come to
mm,
mathematics and physics, they said, no, you cannot be, rather choose something else. But I said, I'm still
Mm,
gonna pursue to be in the medical field, though I may not be
mm,
a GP, though I may not be a physician, but let me be there for the patients. Let me
yeah.
be an advocate for the patients. You know, you get to have patients that comes there demoralized because they were told that you are on the
Mm,
fourth stage. You were only left with 2 months or 2 weeks to live. But being a shoulder to cry on, instilling hope in the hopeless, that's what I saw myself to be. And hence I
mm,
actually decided to go into nursing because of how my grandmother showed me that you know what, you can still instill hope in people who have lost hope and be a shoulder for them to cry on. So that's what we need to do as health professionals for our patients. Let them see that there are still people who care, even when I'm on the fourth stage of cancer. Because you know, you get
mm.
to your doctor, they tell you that there's nothing we can do anymore. But when
Yeah.
you sit down, listen to them, give them an ear, you have their attention, you are literally saying to them they still value, they still have got value
Mm,
while they are still living. There's still somebody who cares for them even in their terminal illness. So let us be that to them, so and that will bring
mm.
hope back to those who have lost hope.
Mm, okay. And your career has evolved though from nursing into diagnostics, leadership, and community outreach. Was that always the plan, or it's something that you discovered along the way?
I've always been a people's person. That's. I remember my wife one day was angry with me that we've been to Durban and you hear people saying Thabang. You go to Limpopo, Thabang. Actually, do you have anybody who doesn't know you? And you
Mm,
know what? If you have always been good to people, I think God then start to open doors that you did not know of.
mm,
So there has always been a leader in me, but I always took it as a limited position. But until I get to this stage where I started to visit communities that are unprivileged, started to visit people that have lost hope, started to see people who have lost it in life. I'm that kind of a person. I don't want to associate myself with the wealthy. I don't want to associate myself with people who are doing good in life. I want those who said, I don't see the light anymore. And through that,
mm,
I learned that there is something that God is busy doing in me. And luckily, I got to host quite a number of events. And when I stood before the people in those communities, quite a number of them have applauded me to say that we have never come across a leader who seemed to be like you, because everybody comes in their caliber and we don't fit. So I'm that particular person. I want to fit even in the unprivileged communities. I want to be the person where they don't see that is Sylvia and she's driving a Mac, she's doing this. I want to fit. I want them to see the same person of their level. So I think through that, that's where doors
mm,
began to open. I did not know that I will be this particular person, but doors got open through the way.
mm, mm. No, it
Yeah.
makes sense. And as a pastor, how has your faith influenced the way you care for others?
I surely believe that to this far I'm carried by the grace of God.
Mm,
And the same grace that carried me, I certainly believe that it can carry other people. And it's for me to go out there and tell them how faithful He is, that He's been faithful to me. As He has been faithful to me, He can still be faithful to them. So I'm just there to share the light. I'm just here to share the message of hope. I'm there to share the love of God. As the Bible says, John 3, verse 16, for God so loved the world. When He meant the world, He didn't say the rich, but He said everybody that He created, the God loves them. Some of the people, because of the challenges and situations, they may not see the love, they may not understand the love, but all things works together for the good of they that loves the Lord. I believe so. So it's just for me to go there and tell them that even this one shall come to pass, and the love of God for you will never fade off. And you know, it is after every storm that we get to see the greatness of the Lord. So it's for me to
mm,
go there and hold their hands, that even in your depth, even in your moment where you see things falling apart, there is still God who can hold your hand like He did with me. I can tell you, Sylvia, that there were points in life where I felt I'm not gonna make it in life. I'm not gonna become anything. There are those situations
Mm,
in life, and something one day just set into my heart to say that stand up. There is still a light. If you can pursue this light, you will get to the point where you want to reach. So there are people whose
mm,
light are still shining, but they need somebody to push them behind to say that let's go this
mm.
direction. So my advocacy in terms of spirituality is that push people until they reach where God wants them to be.
No, that's true. And as a motivational speaker, what's the most powerful lesson you've learned from your audiences? Because I believe that as a motivational speaker, you also, as much as you are teaching and motivating people, but you also get to learn from them. So, are there any lessons, maybe, or is there any lesson that you've learned from your audiences before?
Yes, definitely. Like I said earlier on, Sylvia, that I mostly go into the deep rural areas. What I've learned is that we always port from our ports to their ports. But in this
Mm,
particular level, I allow them to pour into my pot. And I can assure you, Sylvia, that there is more knowledge in places that have been neglected. I can tell you today that there are businesses that have started because of the people who have been neglected by others. So I've learned to say that there are brilliant ideas in those
mm,
deep hidden areas. So that's the most
mm.
important thing that I've learned. And one of my businesses is flourishing so well. And what I've
Wow.
learned about this business was from that particular area where nobody goes. But the Lord led me
Mm,
into that particular area. So we shouldn't only pour into theirs. We must also allow them to pour into ours, because knowledge is something that is when we say you are rich, let knowledge be one of the substances that makes you rich. So I acquired more knowledge from those areas, and I'm happy to be there. And if I can tell you, Sylvia, is I wish one day I can make so much money that I can go and build there and stay within them, so that I can gain more
mm.
knowledge from what I learned from them.
Mhm. No, the money is coming. People can already see that no, there is money somewhere. So
No,
it's
certainly.
definitely
I
coming.
received that, Sylvia. I received that.
Yeah. Okay, Thabang, and congratulations on your nomination for the 2026 African Health Excellence Award. But I'm curious to know, what was your reaction when you received the news? Because, yeah, people have different
Yo,
reactions.
Sylvia, I was over the moon. I was over the
Mm.
moon. I don't know if you have ever had this version that Limpopo boys are mama's boys. I don't know if you have ever heard. Every time when they will go home, Barry,
Yes,
they
yes,
say,
you know,
"Rea-
that is why you
rea
must
bom."
play very, very far from them as
Yeah,
a
so
woman.
so so the first point of contact, the first person I called was my mom to say that, you know what, there's
Oh.
something I need to tell you. You must sit well. Please drink a glass of
Mm,
water before I can tell you. And when I told her that I was nominated
mm.
for these awards, she was over the moon. One thing about my mom, she
Wow.
wants to see us progressing in life. She wants to see us
Mm,
having good things. And I said to her, this is yours. For all the years that you have
mm.
carried me from my childhood to today, this is yours. And there's one GP in where I grew up in Limpopo. His name is Dr. Satehe Morokolo Satehe. He was one of the
Mm.
nominees last year.
He actually won
We
over. He was an overall winner for
Yes.
2025. I know.
So
Yeah, yeah, I
he's
know
my
him.
He's my childhood GP. So to this date, he's my
Wow.
family doctor. So when I saw this nomination coming in, I'm like, this man has always been motivating me, has always been my
Mm.
anchor. Uh, and now I'm following in his footsteps. This is something amazing in my life, and it really shows me that I'm on the right track. So I was
Wow.
over the moon when I went and shared with my family. My wife said to me, I need to take you out tonight. I need you to go and eat out, because this is a great
That's nice.
achievement.
Yeah.
And yeah, and
Mm.
my colleagues were over the moon about it. Everybody around my circle were over the moon
Wow.
about it. And when I posted it on my social to say that I've been nominated, everybody was saying, "Send us. How do we vote? How do we vote?" I'm like, "Oh wow, God, this is
Mm,
this is really you
wow,
doing wonders in my life." Yeah,
wow,
I'm
that's great.
overexcited.
Yeah, because actually, when you see people saying how do it shows and confirms that what they agree with the nomination to say no, this person really deserves this nomination. Because the nice thing about this platform, Tabang, is that the people who are receiving the care that you are giving them are the ones that are actually nominating you to say, we've seen Tabang, he deserves this, this award. So it is so nice because even Dr. Sateha, I had a conversation with him when we had a symposium in Pulukwane, and he was one of the speakers, and we had this conversation, and he did say, you know what? I never knew how many lives I've touched until I got this nomination, because then I received a lot of testimonies from my patients, the community, saying, you know what, we are voting, this one is for you, you deserve this, saying they were sharing with him stories that he wasn't aware of. And yeah, so this is so so exciting. And what does this nomination mean to you personally, Tabang?
Sylvia, to me, I don't want to lie to you. This says to me that you can still reach greater heights. If this
Mm,
is an opening statement, if this is an opening platform for you to reach greater heights, take this and use it for you to reach heights that nobody has ever saw you
mm,
going to. And I was so touched. As I said
mm.
to you, I'm people's person. When I posted that particular poster of being nominated, the first person to comment on that was Dr. Sateche's wife, and was like,
Oh,
"Wow!" So
nice.
hence I'm saying,
Mm,
yes, hence I'm saying, if this was a first opening door for me to reach greater heights, I surely
mm,
believe that
mm.
there are more doors that were closed that are still yet to be opened. If this one could be opened, then others can also be opened. And I surely believe that when this one got opened, the money one is also about to open.
Yes, no, definitely. That one you're not. It is a guarantee. And why is recognizing healthcare professionals important, according to you, especially those serving communities beyond hospitals? Because we do have healthcare professionals that would say, I'm hired to be a nurse at this clinic, my work ends here, or I'm in a hospital, my work ends here. So, but we have people like you who are going beyond the hospitals or clinic walls, serving communities, and during the time where they were supposed to be spending it with their families and all that. So why do you think maybe it's important for us, to recognize those healthcare professionals?
If I can be honest with you, Sylvia, do you know that quite
Mm,
number of cervical cancer patients? I want to give you this example. These are
mm,
people who have been sitting in communities. They don't even know what pap smear is. They don't even
okay.
know how to go to a doctor. How will I afford to go and do a pap smear? And they are cost minded. That's what they are.
Mm,
Until
yeah.
you go beyond your call of duty to go to communities, start to invite NGOs that does all those kind of things, you get
Mm,
to
mm,
understand that we are sitting with more cervical cancer of people who did not know the protocol and procedures to follow. Which hospital do I go to? I've never even heard of a pap smear. I don't even know the importance of a pap smear. So this is for us to go out, educate them about things that can become danger in their lives. Whereas
mm,
I can't really say they are ignorant, but lack of information can actually lead
mm,
somebody to terminal illnesses. Let me tell you something. In quite a number of communities, we are sitting with about 60% of HIV people that have never been
mm,
tested. And it gets spread around the community. And
mm,
you get to learn later when nothing can be done anymore. Whereas if we go
mm,
beyond our call of duty, invite NGOs, they do come. I've done that so many times. You invite these guys, they come to the communities, they conduct pap smears, they conduct. I can't divulge on this platform, but there are quite a number of people that we have found to be positive for certain things. And if that could have been detected way before, then the conditions would have been manageable. But some you get them at a very advanced stage, because we are bound by borders of I'm employed here, cannot go beyond. But going beyond, it saves lives. Going beyond, it builds future communities. Going beyond, you get a child who I've got this particular case, Sylvia, where we still have got people who do home birth, home deliveries.
Sure.
Ne? They don't even go to the clinic, and you find this is from an infected mother to the child, because this person has never gone to the clinic to do the
Shame.
pregnancy thing all along. So it gets transmitted from the mother to the child, and you get amazed, why is this child getting it's undeveloped, only to find later that because of not going through the processes of antenatal and postnatal, because they don't know about these things. They are only limited to when you go to the clinic. So people who are still doing home deliveries, they don't get to know about this info. But if we've got people who will be like Thabang and go beyond their call of duty, go and educate these people the importance of a pregnant woman going for the prenatal screenings and everything. So you get to you get to realize that we are sitting with a ticking time bomb. So for us to have a good community upbringing, let's break the protocol. Let's leave the borders of where we are employed and go an extra mile. I know it's time consuming. I know it's tiring, but it's for a good cause, Sylvia. I can tell you that ever since I've started these things, I've seen lives being saved. I've seen lives being I wanted a good way to put it. I've seen lives being saved. I've seen lives, people recommitting to their good status of health status. So it's about time that we health workers, if we can join hands and go beyond our call of duty, definitely we will have a beautiful South Africa. We will minimize the infections like your HIV. We will minimize your cancers. We will minimize quite a lot of things. And when we do that, I can surely tell you that, Sylvia, we will also be helping the Department of Health or of Health to spend less, because now when you've got a terminally ill cancer patient, because of this person has never been introduced to any clinic or anything, so the budget becomes greater, because now you are treating a condition that is then for a lifetime. But if we can do cure is better than prevention is better than cure, that will definitely assist Department of Health to have a smooth run.
No, that's true. Because I guess the department, it's like we believe that the department is a building or it's someone, but we forget that we are the department. We can do the work, we can
Definitely.
make the difference. Yeah. But now we are going to move to our audience favorite segment, fact or fiction. So you'll tell us whether this is true or false, and you can explain if you want. So the first statement says health screenings are only necessary when you are already feeling sick. Is this true or false?
That is not true. It's false.
Mm, mm, okay. All right. Young people don't need regular health checkups. They are still young, most. They are still strong.
That is false, Sylvia. That is false. We need to regularly check on ourselves. I was reading this morning. Somebody posted a status to say that men will always take their cars for service on time, but will fail to take their bodies for service on time. And we are not living on a rented body. You get this once, and if you die, you die. So we need to regularly check on ourselves.
No, that's true. Diagnostic tests are only done to confirm serious illnesses.
Not really, not really. To also check on yourself. It's not done to check such, but this is to say, am I healthy? It's not only to diagnose but it's about to look after yourself.
That's true. Men shouldn't talk about their mental or emotional health because it makes them look weak.
Okay. Thank you for asking that question, Sylvia. One of the things I advocate for is that quite a number of disorientated men who are family disorientated, is because they've got nowhere to pour to. They've got nowhere to cry to. And let me tell you something, Sylvia, when you've got a drum has got a certain capacity. You can keep on putting water in the drum until it's filled. And when it's filled, when you continue to pour in, it then spills out of its capacity. So you get men who harbor things within until they become overburdened. And that's where you see men becoming aggressive. That's where you see men becoming violent. Hence, we now speak about gender based violence, is because men have got less platforms to speak out. Men, it's like, I've always been, it's like Women's Day, Mother's Day, and all this day. So with men, quite a number of things are limited. And in my own language, they always say, "Monna ke nku o llela teng," which means you must cry from the inside. Now, when you stop crying from the inside, you start to cry out. That's where we see men killing women. So men are more important. Men are, the mental health of a man is important because a man is a provider. So somebody to be a good provider, they must be in a good state of health. And you know, one thing, Sylvia, that I hate, that I don't want, it's a man who tries to address his issues and he gets sidelined, because you are now creating a monster in that man. So let every man have somewhere. Let there be an ear for men to cry out. And after they cry out, don't just listen, but act on what they are crying to you about. So my perception, Sylvia, where I am at the moment, I'm 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 more advocating for men than any other person, because we need strong families, we need family orientated men. But as much as they are burdened, we can never have good families. We will always have disgruntled families. So let us allow men to cry out. Let us allow men to pour out. And let there be men who will be shoulders for other men to cry on. And be somebody that one can confide in. You understand? So I believe men's health is very important, far important than any other thing.
No, that's true. Faith and modern medicine cannot work together because faith says you just refuse the report that the doctor gives you when they say you have HIV or you have cancer or whatsoever. Faith says, say no to that. I am healed, through his stripes. And medicine says, we have diagnosed you with this, so now you must start treatment. So, what do you say on the statement? Faith and medicine cannot work together. True or
I
false?
always tell the people I always tell people that I'm leading that take your medication with faith. Take it with faith. So still digest it and apply your faith. Because I don't believe that God can raise me to where I am and allow me to be in the pathology for no reason. I don't think God can actually give somebody the intelligence of going to school and become a doctor for nothing. So there is a reason why we've got doctors. There is a reason. So let medication heal your body, your physical body. Let the spiritual
Mm,
person come and heal your soul. So there's no way they cannot work together. They work together.
mm,
You need this body, and as much as you need the soul. So let they work
mm,
together. There's no way they cannot work together.
No, you've explained it so nicely. And as someone working closely with communities, Thabang, what health misconceptions concern you the most in communities?
Please come again.
As someone working closely with communities, what are some of the health misconceptions concerns you the most, or that you normally hear in communities? Some of the misconceptions about health.
Okay, let me talk about this particular one. Um,
Mm,
I've been dealing with a case where a certain young lady was telling me about I don't want to get pregnant, and
mm,
I always go and do the contraceptive.
Mm,
And to me, I asked her, Sylvia, to say that you might not want to get pregnant, but are you
mm,
aware that in the process you can contract
mm,
HIV? So they believe that when you use contraceptives, ne, you are also
mm,
preventing HIV at the same time, and it is not.
mm,
So I'm
mm,
not so sure if this is lack of knowledge, or lack of us going out to educate them that your contraceptive doesn't also prevent HIV, because you get quite a number of them who goes for contraceptives, but they don't
mm,
actually abstain or go for protection. So they think you can prevent HIV at the same time with the pregnancy by using contraceptives. So I think that's the misperception they have about um, this particular thing.
Okay. And if you could introduce one health initiative in every South African community tomorrow, what would it be?
Can I give two? If we
Okay.
can, yeah, if we can regularly, if women can regularly go for their mammogram and go for their pap smear, that would please me the most. And
Mm, mm,
in terms of men, if we can have men who are having one partner, that would please me the most. Let's not
mm,
gallivant around and taking one infection from here to the other. Let us raise men who are tamed to one
mm,
partner. That's what I can definitely give out.
mm, mm. Okay. And if your younger self could sit beside you today, what advice would you give him?
I would say I should have done better before I could come to this point. I
Mm,
think there was more effort I needed to put in those days than now, and
mm,
I would have achieved more than what I've achieved now. So that's the advice I could give the current me while I'm in the back, to say I should have put more effort, because then
mm,
I thought it's just one of those things, it will come and pass. But now I see that should I have done great from then, now we could
mm,
have been speaking something different. Maybe I could have employed so many people. I could have alleviated
mm,
poverty in communities had I taken an initiative then in my younger days.
mm. Okay. Every great healthcare professional has people who quietly support them. Who are the people that hold Thabang together?
Far most, I would say my mother, as I always mention
Mm.
here, my
Yeah,
wife.
Vela, I knew that there's no way she was not going to be there.
Yeah, my mother, my wife, those are the two
Mm,
women that actually pulls through for me. They pray for me. And there's a friend of mine that I always want to mention. He's Matumi Maswadi Kabelo, and his wife. They always carry me. And the rest of my family, I don't want to lie to me. They whenever I call them to say that I've got a situation in this community, I've got people who need clothes, I've got people who need this, they don't keep they don't hold back. They go as far as giving more than what I've asked for them to do. So it's my family, it's my friends, and mostly my wife and my mother. So those are the people, and my children also. Let me say this: they pat me in the back and give me courage to say, "Papa, push on." So I'm blessed to be around such people.
okay. And how do you want to be remembered one day when Thabang is gone to be with the Lord? How do you want Thabang to be remembered?
I want to leave a legacy, Sylvia, not of wealth,
Mm,
not of money, but a
mm,
legacy where people will I will introduce people to opportunities.
mm,
I want to leave a legacy whereby somebody will tell his or her children that, there was once an old man by the name of Thabang who actually made me to see a bigger picture than what I actually took myself for. So I want people to understand that their future relies in them, their future relies in their output. So I want people to start to take their life serious. They mustn't depend on other people, but they must depend on themselves to push hard to reach their goals. So my one thing that I want to be remembered about is that this Thabang that we are talking about today has helped me to reach a certain goal. Hence, you see me be a family. You see me being a family orientated man. Hence, you see me working in that company. Hence, you see me working there and there. And what pleases me, Sylvia, is that this very yesterday, because of such things, because of being vocal, because of being out there,
Mm.
talkative, and yesterday I got a call. Somebody was looking for two males to work in his company. I'm not even close to this person. And I went and looked around, and I got two young men who were desperately looking for a job. And they got a job today. They are working. This is what I want to be
Wow.
remembered for. I don't want to do
Mm.
it for my family, but I want to do it for people who are not close to me, so that it doesn't look like I want good things for my family, but I need good things
Mm.
for everyone, not just for my family. So it would please my heart that the day the Lord remembers me, then I've put people into places where they will be able to
Mm.
provide for their family, where they will be able to say, you know, my wife, let's go out, let's have dinner, because of I would have opened that opportunity for that particular person. I want people to be happy. I want people to see life in a different dimension.
Mm. Mm. Yeah, and time flies when you're having great conversations. But Thabang, thank you so much for joining us on Behind the Scrubs Couch. Your story reminds us that healthcare is about so much more than treating illness. It's about serving people with compassion, leading with integrity, and caring for the whole person. Congratulations once again on your nomination for the 2026 African Health Excellence Awards. We are looking forward. I hope your wife has started designing outfits for you, because we are looking forward to having you on the 14th of November in Durban.
November.
And yeah, thank you so much, yeah, for your unwavering commitment to improving lives in our communities. And to everyone watching, thank you for joining us for another inspiring conversation. If today's episode encouraged you, don't forget to like, subscribe, and share. Join us again next time on Behind the Scribes Couch, where we celebrate the people behind the profession and correct health misinformation one conversation at a time. Thank you so, so much, Thabang, for your time. We really appreciate it, and stay blessed.
It's a pleasure, Sylvia. Same to you too. I really enjoyed being here. And thank you. Can't wait to see you on the 14th of November. Somebody has already bought me a ticket for the flight. Thank you.
Oh, nice. Wow, wow. I wish I was you, hey?
No, certainly. Thank you, Sylvia.
All right. Thank you so much, people. Bye.
Bye.